good morning viewers. I've had a request to tell you guys about my treatment sessions, so I thought I'd take this opportunity to do that. And first of all and foremost is I treat my patients for an hour long because I specialize in chronic pain patients. So I see patients with fibromyalgia, headaches that have been there for 40 years, back pain, neck pain, arm pain, any funny pains that you're having, problems that you're struggling with, if you've had surgeries that you've never quite recovered from. Those are the kind of treatments that I do. So I'm going to talk about the different techniques that I use on here. First and foremost, I do like my needles. Okay, so we have acupuncture needles. They come in different sizes, and you get the short ones of 3 centimeters long. This medium one is 50 centimeters long. This one is 75 millimeters long, and then I have 100 millimeters long. Each one will do a different area. So this would be, for instance, your buttock area. You even have the 100 millimeters for the buttock area here. This is your lower back area, sometimes in the neck. This would be your neck and your thoracic area. And how they work is because it's got a copper point and a silver point in it. So if I had to take out the needle here, they're all sterilized needles. So they all come out with a little blue spigot to hold it into place. And if I had to take out the needle, now you can hardly see the needle there, but it's got a silver point here and then wired copper points on the other side there. And how it works is when I stick the needle into the person, initially it's a foreign object that's been put into the person. So you will activate your antibodies to the area to help go and help with inflammation in the area. You will get inflammation in the area from the needles. And then the antibodies will help to improve the pain in the areas. It also causes a magnetic current. So the magnetic current uses the blood flow to create the magnetic current, and all the P factor, which is your pain is called P factor, then gets carried away. All these chemicals get carried away out of the area, which reduces the pain in the area. From that you then get twitching of the muscles, and maximal contraction gives you maximal relaxation, which is why the muscles were released. Now, out of all the techniques, the needles are the most effective. So I know sometimes that people say, oh no, but the needles are so sore. It's not sore like an injection, it's your pain source. So the aching that you get, the headaches that you get, I will elicit the same pain during the treatment, and the pain will subside during the same treatment. It's like taking a weighing scale, and do I want to have pain forever, or do I want to have pain for 10-15 minutes while the needles are in and then feel much better afterwards. So needles are, for chronic pain patients, you have to get the needles. It's absolutely key. Onto the needles, on some cases I will put the e-stim machine. So this is actually a little TENS machine, but it's got little crocodile clips on the end. So I will connect the crocodile clips onto the needle points, and then the current will flow through the body. It will cause the muscles to jump, so you'll get like a twitching action of the muscle like this, which helps to make the muscle relax even quicker. So it works quite nicely if you get cramping of the muscles, or if the muscle is exceptionally tight, then I like to use it. So your very acute phases work well with this, or very, very tight phases work well with this. What I also have available here is a little tuning fork. So this is a vibration of 128 hertz. They use it for diagnosis of middle ear infection, to hear, which side you hear better. They use it for testing sensation on the person. It vibrates all the way down to bone, and it helps to release those stubborn muscle spasms that don't want to release. I like to use it for that. I like to use it on the occiput for where the muscles like to insert on the area, and that works actually quite nicely for that. Then what we've got here is we've got the hypervolt. It's a little vibration machine. This is a new little gadget that I've recently purchased. It's not painful at all, it's actually quite very nice. I use it on my cat and my tortoise for treatment of their asthma and their lung problems, and the cat absolutely loves it. I also use it on patients that have got swelling in their legs, or chronic pain patients where you've got stagnation of the muscles aren't contracting properly. It helps to just improve the circulation in the body, and helps for trophodema and cellulite, and just areas that are not that nice. Also just to reduce the muscles. Then what we've got here is the disinfectant. I just want to show you this. This is what we smear on the patients before we stick the needles in, because the area must be clean. So I like to do the needles first, because I can have the area cleaned. If I put my cream on that I massage with after the effect, I don't like using needles afterwards, because then you can get the cream being drawn into the hole that the needle creates, and it can cause infection. So I do my needles first with the disinfectant on the area, then I put the needles on, and Bob's your uncle. I then massage with a product called Deep Touch. I like the smell of it. A lot of the patients like the smell of it. It's got a combination of St. John's wort, arnica oil, and calendula. So it smells like fresh mint, and it doesn't get absorbed too quickly by the body, so it massages quite nicely. So I do a good massage session on the body. I like to work the whole patient, so I always see my patients for an hour long. So they get massage, and I do just about all the treatments on them, and I work the whole body as well. So then with that, if I'm busy on the top half of the body, they can get cupping on a different part of the body. How the cupping works is you have different sizes again of cupping. You would put the cup on the area that's affected. I've got a little gun that sucks onto it, and then I would suck it up into the thing, so it makes like a muffin of skin up into the body, which is actually quite cool. If you've got a tattoo, it becomes 3D. And this feels like somebody is pulling you up and putting hooks in your back and pulling you up onto the ceiling. It sounds terrible, but it's actually very, very nice. So you'd put them next to each other like that. If the skin's too tight or it's too close to each other, the thing will pop off. And if it's also too tight, just generally that it's not loosening up. So this helps to loosen up the fascia, the myofascia of the skin, which has an underlying pulling effect on the muscles, which improves your circulation again. It softens your skin and makes it far more pliable and reduces your pain. So if I had to say for you, most of the patients, their skin should pick up like puppy dog skin. So if you pick up your skin like this, it must pick up nice and loose. If it doesn't pick up, it means that it's got trough edema underlying it. The cupping works very nicely for loosening that up so that you get this nice, soft, pliable skin. What I also like to use is I like to use the shortwave machine, because it's got a penetration depth of 10 centimeters. It's also pulsed, so the only contraindication would be for people that have got pacemakers, but metal is not a contraindication because it's a pulsed heat, so the metal doesn't absorb the heat then as much. So you would put it on anything from lung infections, so pneumonias, sinus infections, sore ears, muscle spasms, neck problems, joint problems like arthritis. These help for those there areas. So I like to add it, even your disc lesions in your neck and your lower back. So I put the machine on, and while the machine is working on one area, the cups are working another area, I'm working another area, the needles are working another area, and I do like to work the whole body. So most of the time I ask the patients to get undressed totally, so that they're just in their bra and their underpants, or in the men just in their underpants. I cover you with blankets in the winter, and I've got an electric blanket on my bed for the cold, for the winter. And then we work for an entire hour. We do any physical problems that you may have, we work on those. We do emotional work here too, especially for those that have been through traumatic events. Those can create your physical problems, so I need to work on the emotional aspects as well. If you've got dietary issues, we help you improve your diet and your well-being. We give you exercises to do. So basically we do a whole rounded version of improving you so that you can be better than you've been. And I need time to do that. So it's not just a quick half an hour session, it is a proper hour session, and we talk all the way through, explaining you what is going on with your body, explaining why it's created or done what it's done. And I believe that if you've got 50% understanding of if you understand what is wrong with you, then you're 50% of the way in healing yourself, because when you know what is wrong with you, then you can get a program set up as to what you need to do to improve your health. So that's in a nutshell what I do here. With that, you've met my animals in previous videos. I've got the animal therapy going on here as well. And the animals have been shown to just improve a person's feeling of comfort. And then they're able to open up more, especially if we're working with emotional things. They open up more willingly if animals are present and they see that you care for the animals nicely. So that's me in a nutshell. I've also got, this is saline, I forgot to mention this. This is saline again that we use for sinus infections or chest infections. And although I don't do that all the time, if a patient, a regular customer of mine, does get sick, I am able to help them with their chest and their sinuses. I also like to do facials on those that have got bad skin, because I look after my skin and I know what to do with it. So if I've got somebody that's got bad skin, we sort of do a facial with them as well. So it's a one-stop shop here where we help you with all kinds of things just to improve your health. Hope this has helped you understand my treatment methods better. And if there's any questions, please remember to drop a line and tell me if there's any other videos you'd like to have made so that you can understand conditions or understand things better. Thanks, have a great day, enjoy the rest of the day. Bye.